Next up will be Dr. Katrine Karmisholt to talk about high-intensity focused ultrasound treatment of cutaneous neurofibromas.
Thank you for having me. I'm a dermatologist from Copenhagen, Denmark, and I'm here on behalf of this competent collaboration between Sweden, Denmark, and Johns Hopkins, and this study was funded by NTAP. So we studied high-intensity focused ultrasound treatment of cutaneous neurofibromas. Now, these patients with NF1 and cutaneous neurofibromas needs no further introduction in this audience. And treatment of these neurofibromas in general have these current available treatments, and there is for these treatments needs for local anesthesia. It's time consuming, it creates wounds, and therefore some downtime, and it's often insufficient as we see in the CO2 laser treatments at the bottom picture, and results often in scarrings when we do excisions. So there is some motivation and a need for a better cutaneous neurofibroma treatment, and both the patients and the physicians treating these patients have a wish list of more efficient, quick, painless treatment with no downtime and no scarring. And this leaves us with the question in this study: may HIFU address these needs? So first of all, what is HIFU? HIFU delivers focal ablation points inside the skin. This eventually turns into tissue destruction that may be delivered at different levels in the skin. Now, may this HIFU be used as a non-invasive treatment for cutaneous neurofibroma? In this illustration, you see a neurofibroma in the dermis and extending a little bit towards the epidermis. And when we treat with HIFU, we apply the probe to the surface of the skin and manually elicit these HIFU doses in multiple doses covering the whole neurofibroma. Ideally, this will leave the skin surface intact and treating the neurofibroma inside the skin. So, the aim of this study was to investigate safety, local tolerability, and efficacy of high-intensity focused ultrasound, for short HIFU, in the treatment of NF1-associated cutaneous neurofibromas. It was a dual-center clinical investigation. In Center 1 in Sweden, we recruited 10 patients, and they also analyzed biopsies of the HIFU-treated cutaneous neurofibromas. In Copenhagen, we included 10 patients as well, and here we monitored the patients' neurofibroma that were treated by imaging of ultrasound. Eligible patients for these studies were adult individuals with NF1 and at least 5 treatable cutaneous neurofibromas. And treatable cutaneous fibromas in this study was flat, sessile, and globular neurofibromas. So for the study procedure, we applied a single HIFU treatment session of each cutaneous neurofibroma. And what you see here is the probe applied to the patient, and it has a dermoscopic image on the monitor where you can see the contraction for each HIFU doses. This is manually delivered by the foot pedal activation. We saw these patients 1 week after the treatment, 3, 6, and 9 weeks, 3, 6, and 9 months after the HIFU treatment. Our primary endpoint was safety and tolerability. Secondary endpoints were efficacy evaluated by clinical evaluation, and we had ultrasound imaging and histopathology. We also looked at patients' evaluations, device feasibility evaluations. And for the results, we included the 20 patients that had cutaneous neurofibromas, and the cutaneous neurofibroma tumors ranged from 2 to 9 millimeters. They were located on trunk and arms. In total, we had 147 cutaneous neurofibromas that were treated, and each patient also had one designated control tumor that was untreated and over the course of time used as a control. Primary endpoints were, we saw the results with no serious treatment-related adverse events at any point of this 9-month follow-up period. When we look at the tolerability for these patients, so immediately after the treatment, we saw a wheal and flare reaction. We also saw edema in most of the patients and erythema. After 1 week, the wheal and flare reaction was completely gone. Edema had sunken to about less than 50% of the cutaneous neurofibromas, but erythema was still a little bit rising. At 3 months follow-up, both the edema and the erythema had decreased, but now we saw the starting of some dyspigmentation. At 6 months follow-up, we saw a peak of this dyspigmentation, and at the 9-month follow-up, this was also starting to fade. No significant scarring was seen at the study termination. Here again, at the 1-week follow-up, you see the specter of the treatment responses that we saw. So we saw occasional erosions, but it reached from no visible damage to the skin after 1 week until clear wounding at the very right of this picture. And the 3 pictures in the middle were the most typical responses we observed. Pain evaluation was evaluated by a scale from 0 to 10, 10 being the most painful evaluation, and here we found a median of 3.5. This was during the treatment. Post-treatment, there was no pain reported. In terms of efficacy, we saw some reduction in 27% of the cutaneous neurofibromas and a major reduction or no longer visible tumors in almost 49%. So together, this was some reduction, major reduction or no longer visible tumors in 76% of the tumors treated. Here you see some clinical pictures at baseline and at 9-month follow-up, and the clinical evaluation was done on a scale from 0 to 10, where 5 was a baseline score, 0 to 5 indicated worsening of the tumor, and 5 to 10 improvement. And what we found was a median clinical score of 7 over the course of the 9 months. In terms of patient satisfaction with the overall healing process, this was evaluated in 4 categories. 0% were unsatisfied, and 5% were neutral, 20% were satisfied, and 75% were very satisfied. The instrument feasibility, here we found no device-related adverse events to the patients, the personnel, or the equipment. The users graded the instrument feasibility from 0 to 4, where 4 were very satisfied the post-treatment session. And here we found a median of 4. Now for the ultrasound monitoring at the Copenhagen unit, you see here some ultrasound images. Before HIFU, the white arrow indicates the skin surface, and the red arrow indicates the cutaneous neurofibroma. And as you can see, after 9 months after the HIFU treatment, this cutaneous neurofibroma was evened out in the skin surface, but there was still a little bit left in the dermis. And here you see the tumor thickness relative to baseline. The orange curve shows the untreated controls, and here we actually saw that they increased a little bit in size during the course of the 9 months, and the HIFU treated fell clearly over the 9 months follow-up. And the histopathology showed here again a clinical picture before the HIFU treatment and then 3 months after. And at this point, there was taken a biopsy, and in the H&E staining of this actual tumor that you see, or the actual treated area that you see here, we saw no scar signs inside the HA staining. However, the S100 staining showed a few cutaneous neurofibroma cells remaining. And this brings us to the conclusions. So this study demonstrates the safety, local tolerability, efficacy, and feasibility of HIFU for the treatment of cutaneous neurofibroma. We found that HIFU for cutaneous neurofibroma is a non-invasive procedure. There is no need for anesthesia, no need for hospitalization, and no downtime after treatment. Improvement we saw in 76% of the treated cutaneous neurofibromas. Further studies will focus on optimizing the HIFU dosage so it can be used for established and maybe also for developing cutaneous neurofibromas. Thank you.
Hi, Vanessa Merker, Mass General Hospital. Thank you for the wonderful talk. I had a question about the feasibility of this moving into clinic. How long did it actually take to treat each tumor? And do you think that there's a limit on the number of tumors that could be treated in one clinic session?
So it's actually a very swift treatment. You apply it manually, each dosage of the HIFU treatments, and one dosage take like a split of a second. And in this study, we treated around the neurofibroma and the whole neurofibroma area. I would say one neurofibroma would take maybe 30 seconds in total.
And do you think in terms of the pain and also just the timing, how many tumors you might be able to treat in one session, knowing that some patients might come to us with hundreds? So
in this study setup, I think we treated in general 8 or 9, but more could be done in a longer session. It takes a longer time to do the study, of course, with all the documentation, but I don't have like a number that you can treat, and it depends a little bit on the patient's pain level as well, because it's painful immediately when it's done, but immediately after there's no pain.
Yeah.
Dr. DeBlanc.
I thought that was terrific and really interesting data. Thank you so much. It looked like some of the selected neurofibromas had neighboring neurofibromas that were larger. Was there any limit to the size of the neurofibroma? The median was or the range all looked like they were less than a centimeter. Is there a limit on that?
So we included the range from 2 to 9 millimeters, and you wonder why we didn't include biggers, or?
Just for practical purposes, I was wondering if this could be applicable to larger neurofibromas that still fit those 3 type criteria.
Yeah. So it could definitely, because you manually apply the dosing, and you can just apply it over a bigger area, and you can also control the depth of you want to put your focus point. So yeah, there's possibilities for extending it to larger lesions.
Lovely, thank you.
Okay, thank you very much.
You're welcome.